We would be hearing from our next speaker, who is not only an exceptional speaker, but also a great and humble chef. Olivier Lermet has worked in health promotion, education programs, and drug policy reforms in various parts of the world. He is presently the Senior Policy Advisor of the United Nations on Office of Drugs and Crimes in the Philippines, and we've known him since 2017. Olivier brings with him a wealth of experience on public policy development, collaborating with high-profile groups on drug policy and health. And he has worked in Europe, Latin America, South and Southeast Asia. I'd like to welcome Olivier to join us for today's discussion. Olivier, the floor is yours.
Good afternoon, everyone, and thanks again to NoBox, of course, for inviting us and putting together that gathering of multi-direction brains, if it's even a word. I was asked not to prepare a presentation. In fact, I think I was like parachuted at the last minute in that session. So I was very compliant in not preparing anything. So I promise you, as we discussed before in the backstage, the most and coherent intervention. And also, I have some comments sometimes that are a little bit reaction to some of what was said in earlier session, because I could not always ask questions or participate. A first general one, which relates maybe to the opening part of the event. It is true that poverty has a number of consequences on a community, on a family, that are likely to trigger a vulnerability to mental health issues that in turn would probably generate a higher risk of becoming dependent. But I also feel that there is a danger when we say that. In what I'm going to talk, I picked Myanmar as a country I'm going to refer on several aspects. And I remember people in Myanmar when I arrived there, because I'm a very veteran old fart, right? I've been in that region for 20 years. And when we were talking about that, a lot of interlocutors were saying, look, you know, when the country will be more developed economically and when eventually we will get to democracy, which at the time looked impossible, then possible, and then now, well, that's really time to have a thought of our friends and colleagues over there. When the country will get there, it will be easier to deal with drugs. And what I was trying to say is no, because economic growth doesn't lead to employment generation and reduction of inequities. That's not automatic at all. That depends on policies, and you may well one day hopefully be a very rich country, but we may still have a big issue with drugs. So that's one, and the other one also. It was mentioned that parenting is key, right? In what can possibly prevent the vulnerability. Good parenting can support the resilience of kids to any kind of risky behavior, not only drugs. That is sure, but I think we have to be also mindful that it's an induction that is sometimes a little bit difficult from parents and some families in some difficult environment. If the father left for good, or if he's working overseas, if the mother is so busy she cannot really fulfill the role of mother. That sounds an easy thing to say. So we should really, when we talk about parenting, we should really include the whole reality of the environment of the kid and who is actually looking after him. That could be the auntie, the grandmother. Right. So I just wanted to say that was from before. Now, when Naomi presented, I felt bad because I said, oh, I'm new and I should go with my usual about convention, declarations, and global things. But I think now we covered the essential, right? In recent times, at least, we have the ministerial declaration, and also before that, we had the UN General Assembly special session on drugs, right? Which came out with operational recommendation that were saying, in short, we need to be more people-centered, and health must be the health as a broad, right? Not only physical health, but mental health should be the center. And that relates also to what Naomi said when she mentioned about that there is only 15% of funding for harm reduction. But that's even worse than that. I mean, 15% of what is estimated to be needed for harm reduction. But even if we put what we have currently for harm reduction and what we have for the health response to drugs all together, this would probably be much less than 20% of what is directed to law enforcement, right? So generally, there is a need to try to see that by doing better health, we will definitely help law enforcement doing their job better and spending less resources also. The first comment was, so I'm going to give some example, like I was saying, like a senile veteran that has like glimpses of lucidity, hopefully. From what I've seen, for the process that we are all discussing about to go well, there is a need really to combine the bottoms up and the top down, right? We have example. So I will refer to example of Myanmar, where it started with a couple of drop-in centers. And then basically 15 years later, there was a change of policy and law. But in the middle, that didn't stop the possibility to act, right? So that was bottom, but also at the top, because we were in a regime that was particularly vertical, right? And at the same time, you have Malaysia that did immediately like impressive gains, but fail at some moment to have consolidated this in a law and a policy. So when there was political change, suddenly some services just disappeared for the people who needed them. So that combination is important. The other aspect is trying to be both pragmatic, inclusive, but keep moving, whatever. The point is not waiting for the perfect wave, not waiting that the people that would have a similar thinking would constitute 90% of the population and then move. I think even when we are optimistic, the population in many countries, there is a small number of people that have the right understanding, and a few percentage that, even if they have the right understanding, are ready to do what is needed to make it happen, right? So what do I mean by not expecting the perfect wave and not being afraid? Oh, this is illegal. You know, Olivier, this is illegal. Well, in all countries where I've been, and initially the law was not ready to accommodate what would be defined as harm reduction, right? In fact, in general, if laws are rarely anticipating on the common understanding, right? They rarely precede. Most of the time, they follow way later, because this is the way laws are done. Politicians do follow all the opinion, right? So in the Philippines, for instance, right, we do have issues related to the overall law, issues related to what the laws relating to the criminal system, right, to the criminalization, etc., etc.
Yeah.
But again, in Myanmar, to give an example, the law that we had there, the penalties were still in rupees, which was reflecting the time of the Indian colonization.
Yeah.
So we had a law that was particularly old. And the law was not changed until what I was mentioning, around 2015. But with some agreement, with some advocacy, with some work, and in all honesty, using the verticality of a military regime sometime. It was even more complicated when democracy was there, to be honest. That's ironic, right? We had a pilot program that was serving 12,000 plus people, right, for a long time, where the people had the different organization could deal with the people, provide different services, follow up, etc., etc., protecting the anonymity of the list, of course, right? And this led to cutting by half the prevalence in Myanmar, right? We had, and in Myanmar, it was a big challenge because the number of people who inject drugs was significantly higher than in the Philippines, for instance, right? So there is a space to move, even if we don't have already fixed the law, enlightened the leaders, etc. There are still a possibility to do that. And I would say there is a high moral obligation to do that in Cebu area, right? There have been several attempts, it didn't work. That's not the reason. We cannot just be talking about the philosophy and not having some services for the people who are dying there, and that could perfectly see their needs met and their health protected. Another consideration is, I was talking about bottoms up and top down. There is a need for some level of organic functioning and more structured functioning. For instance, just to give the example of Myanmar, well, ironically, I was with Doctors of the World before I joined UNODC, so I had to switch perspective from my NGO perspective to the UN. And there was at the time the will to have something called a township steering committee, so would be the equivalent of a barangay steering committee or something. And at the time, we felt also, because the environment was about a will to control civil society in Myanmar, that we didn't like the idea. I was calling it the Tanshui Committee, the general in charge at the time. But in fact, this was done in an area called Lashio, and ironically, I was asked to kind of support that process. But that process gave some sustainability and solidity to what was being done, right? Several organizations, so it was clear where was the dropping center, how the needle were going to be collected. Even there was a needle patrol, which means the NGOs were going to collect the needles and any other waste, in fact, in the community. So they were not seen as people supporting that needle and syringe thing that sounds dangerous, but rather the people who clean the streets and even supported the incinerator of the hospital, right? That was useful because it was a way to try to reduce overlaps between organizations and try to encourage cooperation. Even that thing was documented in Open Society publication, Protect and Serve, which is rare, right? A credit to something like DC. I'm just kidding. So I think we can trust on the dynamic of communities. And in the Philippines, there is no doubt that there is a drive, there is an interest, there is a will, there is a capacity to do plenty of things, to organize that and to try to link up with whatever macro system as is planned under the national strategy, right? And by the way, that's an important discussion, because in the legislations that are upcoming, some are talking about that, the anti-drug committees, etc. The other lessons, Humble, is that what really makes a difference generally is the mayor and the chief of police. In most of the experience I know, in Myanmar, in Canada, somewhere, etc., the civil society generally wants to do things. That's in the nature of civil society. And the medical sector also wants, with some limitation, because this is clearly a complicated area for doctors in general. But what really makes a difference is when we have leadership from a mayor or police. That's where things go well. So in our job, it's having 100 USEC Reyes in the country. I don't know if there is a way to replicate him. But seriously, some champions are born, and some champions are also groomed. We provide the evidence, they taste, they don't believe us, and then maybe they say, okay, it's my thing. And then as politicians, they can really make things happen. And we know that in the Philippines, the local government will be more influential in many times than some of the national policies. Another waiting for the perfect way. Oh, Olivier, in our country, the data about drug use prevalence is very political. It's not very good. Well, I've not been in any country where it's good. In fact, there are always a political dimension. So in some countries, they have more time, more experience. They have kind of reduced the weakness of the data. But most of the time, we have to live with data that is incorrect. And to get better data, we need better services. Data will come from the services rather than, again, a top-down data collection just led by the law enforcement sector. I would not want to come back again to the idea that there is no strategy, no plan that works when it aims at fixing people against their will. That just doesn't work. It has been seen over decades. And we do have, when we want to have a system in place, we do have that inconvenience of objectivizing the people that benefit from the services. And then, yes, words do matter. So I just wanted to rebound on what Naomi was mentioning. Words do matter. And I would say, most importantly, when the words are related to the people who use drugs or the people who could use drugs. That is very important. And complex. It's difficult to take out some vocabulary that has been encroached in culture for years. I am very mindful of the importance of words when we talk about the people, because that stigma and discrimination it's the base of everything, right? Now, the words that are defining the approaches, I am a little bit more flexible. I just wanted to explain that. In Myanmar, for some reason, we couldn't say harm reduction for years. So we were saying reducing the harmful consequences of drug use. We were fooling no one, not even in the government, but it was just, there was a need to do that. And I felt that something reducing the harmful consequences of drug use that did cover 12,000 persons was more important than something called harm reduction that was reaching no one. So what I mean is, in the way we want to explain our topic, I think we should be flexible, right? I think we can be ready for some trade-off, as long as we don't trade off any of the people who really need the services and would be serviced. I know there may be disagreement, and to be completely honest, I was telling Ines that why not calling this not a harm reduction summit, but out of the box approach on drugs, just for the terminology to be more welcoming. It was not possible for a number of reasons, but I think the word do matter, but the most important words are the words who are related to the people. I would have liked to talk about all the implication of the people who use drugs, the criminalization, and the prison system in the Philippines. It has been done already by some speakers. I think this would deserve a conference or a summit on its own, right? Because there is so much to say in the Philippines being the most overcrowded system, right? But the other part is there is so much that can be done from Bangkok, New York, etc. I think if processes work, they really have a national drive, right? They are always inspired and benefit from a number of assistance. But I realized every time I was coming to the country itself that, yes, there were other considerations that I couldn't see from Bangkok, for instance, right? So that we need to really tackle, to use the principles and what we know, but to really adapt to the particular context, right? There is, yes, that's a no, not one size fits all in a way also applied to countries and not to individuals. I just wanted to, again, to also give an example from Myanmar. So that example was probably at the time I was transitioning from Doctor of the World to the UN Office on Drug and Crime. So we had one of our peer educator for drugs that was a long time drug user and in methamphetamine, and he was positive and he had a lot of difficulties, and he was one of the best. He was fantastic. But he once he told us, look, I like drugs over life, which was, well, his choice. He was the most educated guy. He knew everything. He received all the assistance. And then we came to visit him, and he was dying. He had, he had sold his sound system, and that was a big sacrifice on him. He loved Metallica so much. He had sold his antiretroviral treatment. So in a way, the assistant, as much as there was a will to help him, he, to some degree, he made his choice. I mean, it's complicated. It would be a long discussion. But ironically, he knew that I was going to work for UNODC. And UNODC had a poster of those classical prevention campaign, Amazing Life Without Drugs, with some local pop singer on it. And he laughed. And he said, Olivier, amazing drug without life. And that was his way to say, I have received the assistance, and honestly, it ended so sadly. It was absolutely heartbreaking for all of us. But that's one example. And I wanted to give another one. We had a sex worker that was one of the best peer educators for the sex workers. And one day, she told us that she was positive, and we said, how come? I mean, and she said, well, this is my husband, and I could not impose condom use. While she knew everything, she was the best. And we were devastated in that case too. And unfortunately, she was enrolled in the antiretroviral treatment. She got better very soon, and now she's a parliamentarian. I won't say where in Myanmar to give her name. So what I mean is also a dimension of choice in the people we do want to help, and the choice should be respected. The help should be always offered, 24/7. It's never too late. But there is always an individual dimension in the relation with anyone with the substance, and this should always be in the base of any strategy, policy, etc. Right? I think I promised a very unstructured presentation, and I delivered. I think that was incomprehensible, so I should speak now.
True to form, Olivier. Very spontaneous, very impromptu. We appreciate your thoughts on the matter. Thank you very much, Olivier.